Welcome to this comprehensive overview of asthma. In this video, we'll explore what asthma is, its underlying causes, how it impacts the respiratory system, and the current strategies used for effective management and treatment. During an asthma attack, triggers cause muscles around the airways to tighten, bronchoconstriction. The lining becomes inflamed, and mucus builds up. Asthma is a chronic inflammatory disease of the airways. It makes breathing difficult due to narrowed, swollen airways and increased mucus production. Common triggers include allergens, pollen, dust, air pollution, exercise, cold air, and even emotional stress. Asthma symptoms can vary in intensity and frequency, ranging from mild discomfort to severe life-threatening episodes. Common symptoms include wheezing, a high-pitched whistling sound during breathing, persistent coughing, especially at night or early morning, shortness of breath, which may worsen with activity, and a sensation of chest tightness or pressure. Additional signs may include tachycardia or an abnormally rapid heart rate, generalized fatigue, and occasional headaches due to insufficient oxygen exchange. Recognizing these symptoms early is essential for timely intervention and effective asthma management. Diagnosing asthma begins with a detailed clinical history where the doctor evaluates the presence and pattern of symptoms such as wheezing, coughing, shortness of breath, and chest tightness. These symptoms are assessed for frequency, severity, and any known triggers. A physical examination follows, focusing on respiratory sounds and signs of airway obstruction. To confirm the diagnosis, spirometry is commonly used. This test measures how much air a person can exhale and how quickly, providing values like the forced expiratory volume in 1 second, or FEV1, and the forced vital capacity, or FVC. A reduced FEV1/FVC ratio suggests airflow obstruction, which typically improves after using a bronchodilator, an important indicator of asthma. In some cases, additional tests such as peak flow monitoring, bronchoprovocation testing, or allergy testing may be recommended to identify specific triggers or rule out other conditions. These combined approaches help ensure an accurate diagnosis and guide effective management. Asthma treatment starts with quick relief medications like bronchodilators, delivered through metered dose or dry powder inhalers. These help relax the airway muscles during sudden attacks, making breathing easier. For long-term control, daily use of inhaled corticosteroids reduces inflammation in the airways and helps prevent future flare-ups. Other options like nebulizers or oral medications may also be used depending on severity. Management isn't just about medication, it's also about healthy habits. Wear a mask in polluted environments, maintain good hygiene to reduce respiratory infections, and stay active with proper precautions. At the same time, it's essential to avoid harmful triggers. Stay away from cigarette smoke, dust mites, and pollen whenever possible. Together, these strategies ensure asthma stays under control and life remains active and healthy. With proper treatment and smart daily habits, people with asthma can lead full, active lives. Regular use of prescribed medication, combined with lifestyle adjustments and trigger avoidance, helps keep symptoms under control. Education plays a major role. Understanding how asthma works and having an action plan ready can prevent many flare-ups. Routine checkups ensure treatment stays on track and adjusts as needed. With the right approach, asthma doesn't have to limit your life. It can be managed effectively. Asthma is a common condition, but with the right knowledge and care, it can be managed effectively. Understanding how it works helps us treat it better and live healthier lives. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to stay updated with more content. And let us know in the comments, what topic would you like to learn about next?